The ruling follows a move from the White House getting rid of health care protections for people who are transgender. New at 5, Action News Now reporter Esteban Reynoso shows us what this could mean for health care access in Butte County.
It's National Pride Month, but the White House's decision to roll back health care protection programs for transgenders is making it feel less than a celebration.
It was like a really big slap to the community, especially since the anniversary of the 49 lives that was killed at Pulse nightclub. That's heartless for someone to do, to make a rule against a community that's already been going through something, and especially on the anniversary of people in that community that died.
On Friday, the Health and Human Services released this statement saying HHS will enforce Section 1557 by returning to the government's interpretation of sex discrimination according to the plain meaning of the word sex as male or female and as determined by biology. This means when seeking medical providers or insurance, you can no longer identify yourself as anything other than male or female. And one trans community member says it's a new challenge.
Yeah, and I feel like a lot of trans people use those resources, like the insurance resource, especially to pay for their testosterone, their estrogen, and if that's getting taken away, how can we afford, our medicines to transition?
There are an estimated 1.4 million Americans that identify themselves as transgender, according to a UCLA School of Law report, and now doctors have the option to refuse to service them.
We aren't second-class citizens. We aren't something that, we're not monsters, We're just people trying to live and be ourselves.
Friday was the anniversary of the Pulse nightclub shooting, the largest attack on the LGBTQ plus community to date. The White House says the date is coincidental, but people think
this is just a step back for the trans community.
The Stonewall Alliance and Chico say this decision couldn't have come at a worse time.
Having healthcare rolled back for transgender people, or protections on healthcare rolled back right now nationally, feels upsetting. It feels frightening. I work with folks who are transgender, and I'm afraid for my friends and for my community.
California already had a law in place protecting against LGBTQ plus discrimination in the workplace. But when it comes to medical discrimination, the state hasn't implemented anything yet. In Chico, I'm Esteban Reynoso. For Action News Now coverage you can count on.
West Virginia did elect its first openly transgender official elected into city